Okay, I need you to see this patient now and take a focus history. Please summarise at the end and consider the differential diagnosis and important investigations. We're going to have 8 minutes for that section. Please proceed.
Okay. Hi there, is it Mrs. Webb?
It is, yes.
Hi there. My name's Chirag. I'm one of the doctors working on the ward today.
Right.
I've just come to have a chat with you because I understand that you've been admitted just now. And
That's right,
Okay.
yes. I went to my doctor's this morning and he was, sent me in here, yes.
okay. So what did you go and see your doctor about today?
Well, for a couple of weeks, I've had shortness of breath, you know. So, and I went to see him and he just sort of sent me straight into hospital.
Okay. How long has the shortness of breath been going on for?
2 weeks.
2 weeks.
Yes.
Okay. And over that time period, have you noticed any changes? Has it become more severe, less severe, about the same?
No, it's getting slowly worse.
Okay.
Yes.
Okay. And along with the shortness of breath, have you had cough at all?
Well, I'd got a cough anyway.
Yeah.
Yes, I had a cough already. I'd
Yeah.
seen the doctor about that before.
Okay. And were you bringing up anything with cough?
Yes, that's when I saw the doctor before. I was bringing some blood up.
Okay.
So he'd already sent me for investigations, for
Okay.
that.
Okay. So I understand from looking through your records that about this previous time that you went to see your doctor, and a diagnosis of a lung cancer was made. Is that correct?
Yes, that's right, yes.
Okay. Okay. And what has been the follow-up for that since you saw your doctor?
Well, he's arranged for me to see the oncologist, but that was going to be today. You see,
Okay.
that was my appointment today to see him, so I've not seen him yet.
Right. Okay. So the cough that you've had has been going on since you first got the diagnosis.
Yes.
Is that correct?
Yes.
Okay.
Yes.
Has there been any changes in your cough?
No.
No. Okay. And along with the shortness of breath, the cough, have you noticed any pain anywhere in your chest at all?
No pain in the chest.
Any pain anywhere else?
Yeah, I had a headache.
Okay.
Really bad headache, for a couple of weeks as well.
Okay, so around the same time as when the shortness of breath started, or?
That's right, yes.
Yeah. Okay. And have you noticed any changes in your vision at all?
No,
Okay.
just the same.
Okay. And with the headache, is it worse in a certain position?
It's sort of, if I go to bend down and pick anything up or something, or it's, really bad then.
Okay.
And it's probably worse in the morning,
Okay.
yes.
And what about the shortness of breath?
That's worse if I'm lying down, perhaps,
Okay.
yes.
Okay. And have you noticed any changes in the strength in your arms or legs at all?
No, I haven't noticed anything like that.
Okay. And any changes in the sensation in your arms or legs?
No.
Okay. And how's your health otherwise?
Well, I was fit and well, That's why it's all come as a shock.
Okay. Okay. And do you smoke at all?
Yes. I've smoked since I was a teenager.
Okay. How much do you smoke?
15, 20 a day.
Okay.
Something.
Since you were a teenager, and that's remained constant.
Yes,
Okay.
yes.
Any alcohol?
Yeah, a few glasses of wine, perhaps at the weekend.
Okay.
Yes.
Okay.
Not a lot.
And what do you do for a living?
I'm a teacher.
Okay. And are you still working at the moment?
But I'm on the sick at the minute.
Okay.
Because I've not been feeling too well.
Sure. Okay. So otherwise, apart from this diagnosis recently, your health's fine otherwise?
Yes.
Okay. You don't take any medications at all?
No.
And you don't go to see your GP about anything?
No.
Okay. Any previous visits to the hospital?
Only to have had a biopsy for the cancer.
Okay.
So that's the only thing.
Okay. And you've not had any other operations, anything
No.
like that?
No.
Okay. Okay. And is there anything in particular that's worrying you about the symptoms that you've got?
Well, just in case it's anything something to do with the cancer.
Okay.
You know.
Anything else that you're worried about?
You know, that's really what I'm worried about. You know, just that it might be getting worse or something. I don't
Sure.
know.
Okay. So just to summarise, you've had this 2-week history of shortness of breath,
Yes.
a continuing cough, and a headache.
Mm.
Is there anything else that you've noticed that's changed or been different in?
My husband said, well, I looked in the mirror and I said I thought my face looked a bit funny, but I couldn't tell what it was. But my husband said it was swollen, the face.
Okay.
Yes, he'd noticed.
How long ago did he notice that?
Well, again, over this same, you know, where I've been feeling poorly a couple of weeks.
Right, okay.
Yes.
Okay. And apart from your face, have you noticed any swelling anywhere else at all?
No.
In your legs?
No.
No? Okay. Okay, so you've had this 2-week history with the shortness of breath, headache, and this facial swelling. And we know about the diagnosis of the lung cancer, which you were due to see the oncologist about today.
Yes.
But unfortunately, the shortness of breath was worse, and you went to see your GP this morning.
Yes.
Okay. Otherwise, you're fit and well. You work as a teacher.
Yes.
Okay, that's fine. All right, so you're in the right place. I'll go and have a chat with my colleague. We'll see what we can do. Okay. And I'll come back and let you know.
Yes, thank you.
Okay. Is there anything else that you wanted to ask me?
No, that's fine. Thank you.
Thank you.
Okay, could you please summarise and consider the differential diagnosis and important investigations, please?
Sure. So this is Robin Webb. She's a 63-year-old teacher who has a known diagnosis of lung cancer, which is due for follow-up with the oncologist today. She's presented with a 2-week history of shortness of breath, headache, hemoptysis and facial swelling. And she's concerned that it might be a progression of her cancer. Otherwise, she's fit and well. No previous medical history to note. She smokes 20 cigarettes a day and has been smoking since since teenager, and occasionally drinks alcohol.
Okay, so what is your differential diagnosis?
So, given the recent diagnosis of lung cancer, I'm concerned about a oncological emergency. In this particular case, superior vena cava obstruction. Given the facial swelling, the headache, and the shortness of breath. Other things to consider would be a pulmonary embolism.
You've had 8 minutes.
And also to consider would be a pneumonia.
Okay, what investigations would you do at this point?
Okay, so initially, from the previous information, I know that she's had some observations done on arrival. I'd like to repeat those to ensure that there's been no change in her EWS score. I then want to proceed to do a set of bloods, including a full blood count, UNEs, and ensuring that we get a calcium as well, and also check her inflammatory markers and a CRP. I then want to do some imaging, so in particular to start with a chest x-ray, and dependent on that, consider further imaging such as a CT scan.
Okay, thank you. We have a CT scan result here.
Okay.
CT scan particularly of?
The chest, sorry.
Okay, so we have a CT scan here of the chest. I want you to have a look at the result and then turn and discuss the management that you would consider given the result of the CT scan with the patient, please.
Hi, Mrs. Webb. So I've just come to have a catch up with you, following some of the tests that we've been doing after I initially spoke to you. So we've done some observations again and taken some blood tests, and one of the other things that you went down for is a CT scan.
That's right. Yes.
Okay.
Yes.
You've had 10 minutes.
So the CT scan we did was of your chest,
yes.
Okay. Are you happy for me to talk through the results of the CT scan with you?
Yes, please, yes.
Okay. Is
yes.
there anyone else that you'd like in the room while we talk through this?
No, I haven't got anybody else here at the moment.
Okay, you're still happy for me to talk through things?
Yes,
Okay.
yes.
So the CT scan showed the cancer that you've got on the right side,
Yes, yes.
but it also showed that it spread slightly towards the centre of the chest.
So, yes.
It's okay. I'm sorry. I know it's a lot of information to take in.
So it's got bigger.
It spread towards the middle of the chest.
Right.
Okay.
Yes.
So, in terms of the details of the CT scan, it showed that from its spreading, it's slightly narrowed one of the arteries that supplies your lungs, and also one of the airways as well, okay, on the right side. The other thing that it's caused a bit of narrowing with is one of the blood vessels that empties into your heart. It's something that we call the superior vena cava.
Right.
Okay. So that's the name we use for the blood vessel that essentially drains the blood from the top half of your body into your heart.
Right.
Okay. Is that making sense so far? I'm sorry, it's a lot of information.
Yeah, I think it's all like pressing on.
There's some compression, yeah.
Yes.
Okay. That compression is causing some of the symptoms that we've talked about earlier on.
Right.
So you mentioned in particular the headache that you've had,
Yes.
the swelling in your face, and also the shortness of breath.
Right.
Okay. So from that, obviously, you know, there's certain things we can do to try and help you with the symptoms.
Right.
Okay.
Okay.
And I'll talk through those different options now. Okay.
Okay. Thank you. Yes.
So before I carry on, is there anything you wanted to ask at this point?
Oh no, I think I understood what you said. Yes.
Okay.
It's done it.
Okay. So the first thing we need to do really is to speak to one of the oncologists that work in the hospital.
Right.
I know you were due to see one today, so perhaps we can talk to the one that was going to be following you up after this admission, okay? And what we really need to think about doing is a way to relieve the symptoms that you've got.
Yes.
So one of the options we have for doing this is giving you something called radiotherapy.
Right.
Okay. Have you heard of that before, or have come across the
Yes,
word?
I've known people who've had radiotherapy.
Okay.
You know, for breast cancer or something. You know.
Yeah.
Don't know quite. Is it just you lie under something, or I don't know.
Yeah, so essentially the aim of the radiotherapy would be to shrink the size of the tumour,
Right.
and it's very targeted, and through that the aim is to reduce the symptoms that you've got associated with the compression that we spoke about earlier.
Right.
Okay.
Okay.
So that's one of the things we'll do through speaking to the oncologist. There's a few other things we can consider as well.
Right.
Okay. So we normally start patients on steroids when they have this condition, okay, and that's something that you'll need to take twice a day, okay, so we can write you up for some steroids, and again that helps with your symptoms. Okay.
Okay. Yes.
Does that make sense so far?
Yes. I know somebody who has steroids because they have asthma.
Okay.
Yes.
Okay. So steroids have a number of uses. We do use them in asthma. But we can also use them in certain cancer cases as well, and they can help to reduce swelling and things like that, so they can be very good to help relieve the symptoms.
Yes.
Okay. Obviously we need to ensure that you do have follow-up with the oncologist, okay, following on from this to find out exactly what type of lung cancer it is and what we can do about it, whether it's something that we can operate on or something that we consider using chemotherapy for.
Right. Okay.
Okay, but those discussions will be taken care of by the oncologist after we've treated this immediate problem and helped to relieve your shortness of breath and the headache.
Right. Okay. So there's I mean, would I be able to sort of still work and that? I'm on sick at the moment, you know,
Sure.
while I have the treatments.
You've had 15 minutes.
So the idea of working or going back to work, that's up to you and when you feel ready to go back. Is that something you'd like to do?
Well, it's a matter of money, really.
Okay.
It's, you know, I only get sick pay for so long, you know. And I wondered about the side effects of the treatments and that, and you know, whether I'd be able to.
Yeah.
To work.
So there's nothing, if you feel well enough, there's nothing to stop you going back from work. There are side effects associated with the treatment, immediate treatment that we're going to give you. But also we need to think about the side effects that might occur from what the management is for the lung cancer and what the oncologist decides is the best treatment for that, and whether it's an operation or chemotherapy.
Yes.
Okay. Understandably, you're not going to want to go straight back to work after having an operation or having a course of chemotherapy, but if that's something that you wish to do further down the line, we wouldn't stop you from doing that as long as you felt well in yourself.
Yes.
Obviously, we'd follow you up throughout this, okay, and make sure that you're seen by the oncologist regularly and he can monitor your progress, he or she can monitor your progress, okay,
Yes.
and see where we go from there. Okay, I'm sorry, I know you're very anxious about this, but you're in the right place, okay, and we'll do the best we can to take care of you.
Thank you.
Is there anything else that you wanted to ask?
It's just sounds very, you know, just sort of all of a sudden it just got bigger and, you know, I just think I'm going to die.
Okay. As I said, you're in the best place, okay, and we'll do the best we can to take care of you,
Thank you.
okay. And you know we already know what we're dealing with in terms of we've done the right investigations, okay,
Yes.
and we can definitely start treatment straight away,
Yes.
okay.
Yes.
If any of your relatives need talking to, if there's anyone that you want to let know,
Yes.
and you want us to talk to them for you, then let us know and we'll be happy to arrange a time to come and have a chat with yourself and your relatives.
Thank
okay.
you. That's very kind, yes. Because my husband, I don't think I can explain it properly to him.
That's fine. I think that's something we can do together, okay,
Thank you.
and explain where we're going from here.
Yes.
Okay.
Yes. Thank you, Doctor.
You've got 2 minutes left.
Is there anything else that you wanted to know?
I can't think. It's a lot to.
It's a lot to take in.
It's a lot to think about.
I'll tell you what. If you think of anything, jot it down or just make a mental note of it,
Yes.
and perhaps I can come and see you in about an hour or so, or later on in the afternoon.
Yes.
And then if you've got any other questions, then we can chat through them.
Yes. Thank you.
Yeah.
But you'll be starting some treatment straight away.
Yeah. So I'll go and write you up for the medication that we spoke about, so the steroids.
Yes.
And I'll get on the phone to the oncologist to sort out what else we're going to do immediately.
Well, that'll help me shortness of breath quite quickly.
Yeah. So we're monitoring your observations, so making sure that you're still getting enough oxygen in your body.
Right.
And if we need to start you on oxygen, we can. And yeah, the steroids should help with that, and also the radiotherapy when we organise that should help with that too.
Thank you very much.
Okay.
Thank you.
But you'll be staying with us,
Yes.
at least for the immediate term. So perhaps when your husband comes in later, if you could get him to pick up some clothes for you and more some personal belongings, okay,
Yes.
just so you're more comfortable.
Yes. Thank you, Doctor.
Okay.
Kind.
Okay, that's the end of the station.